When it comes to prostate health, one of the most common and often misunderstood topics is masturbation. Men over 50 especially tend to ask whether it's good, bad, or neutral for their prostate. Before we clear up myths, it's important to understand the basics of the prostate and why its health matters so much as men age. The prostate is a small gland, about the size of a walnut, located just below the bladder. Its main role is to produce seminal fluid, which nourishes and transports sperm. But beyond reproduction, the prostate has a big impact on urinary health and overall well-being. When the prostate enlarges, which often happens after the age of 50 due to a condition called benign prostatic hyperplasia, men may experience frequent urination, weak urine flow, or difficulty fully emptying the bladder. Some men also worry about more serious issues like prostatitis, which is inflammation, or prostate cancer, which is a major health concern worldwide. Now, here's where masturbation comes into the discussion. Over the years, several studies have explored the link between ejaculation frequency and prostate health. One large study, published in the Journal of the American Medical Association, showed that men who ejaculated more frequently, about 21 times per month, had a lower risk of developing prostate cancer compared to men who ejaculated less often. The theory is simple. Regular ejaculation helps clear out fluids, reduces the buildup of harmful substances, and promotes circulation in the prostate area. Think of it like flushing a system so it stays clean. When the prostate is active and emptied regularly, it seems to maintain healthier function. But it's not just about cancer risk. Ejaculation, whether from masturbation or with a partner, also affects hormones and blood flow. When a man reaches orgasm, his body releases oxytocin, dopamine, and endorphins. These are feel-good hormones that lower stress and support better mood. Stress itself is a hidden enemy of prostate health because high stress raises cortisol levels, which can indirectly affect testosterone balance and immune function. A more relaxed body is less inflamed, and less inflammation means less strain on the prostate. Another angle to consider is circulation. Good blood flow is vital for the prostate, the pelvic floor, and sexual health in general. Ejaculation acts like a mini workout for the pelvic muscles, improving oxygen delivery and circulation in the lower body. For men over 50, where circulation tends to decline due to aging, high blood pressure, or cholesterol, this natural stimulation can play a supportive role. It's not a replacement for exercise or medical care, but it is part of the body's natural design. Now, a lot of men worry about frequency. Am I doing it too much or too little? The truth is, there is no one-size-fits-all number. For some men, ejaculating a few times a week feels natural and comfortable. For others, once every week or two feels right. The key point is regularity. Just like exercise or eating healthy, consistency tends to give the best benefits. What's important is balance. If it feels like it's interfering with daily life, sleep, or energy, that's a sign to reassess. But in general, masturbation itself is not harmful to the prostate. In fact, it may help support its health. Let me also clear up a common myth. Some older men think avoiding ejaculation altogether saves their prostate or preserves testosterone. In reality, long-term abstinence doesn't give the prostate extra protection. In fact, the opposite may be true, because lack of regular release can allow secretions to sit in the gland for too long, which may contribute to discomfort or even increase the risk of problems. Testosterone levels are not wasted by masturbation. The body continues to produce this hormone in a steady rhythm, influenced more by age, stress, diet, and sleep than by ejaculation. As we continue, we'll look at the biggest myths that have been circulating for decades, myths that men over 50 often carry with them and that may be holding them back from understanding what really matters for their health.
But before moving into those myths, here's what I want you to remember from this first section. The prostate is an active gland, and keeping it active through natural release is not only normal, it may actually protect your health. Regular masturbation is not something to feel guilty about.
Now that we've built a foundation on what the prostate does and how ejaculation can influence its health, let's break down some of the most common myths men over 50 carry with them about masturbation and the prostate. These myths are powerful because many of us have heard them since we were young, and over time, they start to feel like facts. But when we look at the medical evidence, the truth is often very different. The first myth is that masturbation causes prostate cancer. This belief has scared countless men into thinking that something natural and common could put their lives at risk. But the research says otherwise. Multiple large-scale studies, including those done in the United States and Europe, show that more frequent ejaculation is actually linked with a lower risk of prostate cancer, not a higher one. Remember, the prostate is like a storage and production center. If fluid builds up and isn't released, it may contribute to cellular changes. But when it's emptied regularly, those risks appear to go down. So rather than causing cancer, healthy ejaculation may be part of protecting against it. The second myth is that masturbation drains your testosterone. You may have heard friends or even old sayings about how sexual release makes you weaker or lowers your manhood. But medically, this is false. Testosterone levels don't suddenly collapse after ejaculation. In fact, some studies show only a very temporary small dip right after orgasm, which quickly recovers. Long-term testosterone production is managed by your brain and testes through a steady hormonal cycle. What actually lowers testosterone more reliably is stress, lack of sleep, poor diet, and too much alcohol. So instead of blaming masturbation, it's better to focus on lifestyle changes that keep testosterone healthy as you age. Another widespread myth is that men should conserve their sexual energy by avoiding masturbation. Some believe it gives them more vitality, strength, or focus. While this idea is rooted in old cultural and philosophical traditions, modern science doesn't support it. What really fuels vitality is healthy circulation, regular exercise, balanced nutrition, and good mental health. Ejaculation is a natural process, and your body is designed to replenish sperm and fluid continuously. Think of it like sweating during exercise. You don't lose your health by sweating, it's just a part of keeping your system running smoothly. The fourth myth is that if you masturbate regularly, it causes the prostate to become weak or enlarged. In reality, prostate enlargement, known as benign prostatic hyperplasia, is mostly caused by aging and changes in hormone balance, particularly with dihydrotestosterone, DHT. Masturbation has no link to making the prostate weaker or larger. In fact, the opposite may be true. Men who maintain a healthy sexual life, whether through masturbation or with a partner, often report fewer urinary symptoms and better pelvic health overall. Then there's the myth that masturbation is only for younger men and that after 50 it's unhealthy or shameful. This belief is one of the most damaging because it creates unnecessary guilt and embarrassment. The truth is that sexual health remains important throughout a man's life. Even after 50, 60, or 70, masturbation continues to play a role in stress relief, better sleep, improved circulation, and even maintaining erectile function. When men avoid it out of shame, they may actually be denying themselves a simple, natural way to support their body. Another one I often hear is that frequent masturbation causes erectile dysfunction. This is not true. Erectile dysfunction is usually caused by problems with blood flow, nerve function, or hormone balance. Conditions like high blood pressure, diabetes, smoking, obesity, and stress are much bigger factors.
In fact, regular ejaculation may help maintain erectile tissues by keeping blood circulating in that area. The muscles and vessels involved in erections are like any other part of the body. They benefit from being used regularly. Finally, let's tackle the myth that masturbation is addictive and inevitably harmful. While it's true that anything done excessively to the point it interferes with your daily life can become a problem, masturbation itself is not inherently addictive. For most men, it is a balanced and normal part of sexual health. The key is moderation. If it feels like it's controlling your day or interfering with responsibilities, then it needs to be addressed. But occasional or regular masturbation in itself is not dangerous. So what's the takeaway from all of this? Men over 50 need to separate fear and guilt from facts. Masturbation does not cause cancer, it does not deplete testosterone, and it does not weaken the prostate. Instead, the science shows that regular ejaculation may help support prostate health, reduce stress, and maintain circulation. Myths can weigh heavily on the mind, especially when repeated for decades. But once you understand the truth, you can make healthier choices with confidence. In the next part, we'll pull all of this together by looking at how men over 50 can approach masturbation in a healthy, balanced way. How often is enough, what habits to avoid, and how it fits into a bigger picture of overall prostate and sexual health.
We've covered what the prostate does and the biggest myths surrounding masturbation. But the question many men over 50 ask is, what's the right way to approach it? The truth is, there isn't a single magic number that applies to everyone. But there are guidelines, patterns, and habits that can help you maintain prostate health, sexual function, and overall well-being as you age. First, let's talk about frequency. Many studies suggest that ejaculating between 2 and 5 times per week may support prostate health. This doesn't mean you have to force yourself into a routine if it doesn't feel natural, but it does highlight that regular release is often beneficial. If you're at the lower end of that range, it's still perfectly fine. And if you're on the higher end, as long as it's not interfering with your energy, focus, or relationships, it can still be part of a healthy lifestyle. The key word here is balance. Masturbation should never replace other important aspects of life, like exercise, sleep, meaningful connection, and social activity. For example, if you notice that you're skipping workouts or staying up late every night to the point where it affects your energy during the day, then it may be time to adjust. But if it fits naturally into your week, it can actually reduce stress and help you sleep better. 2 things that are especially important for men over 50. Another important tip is to pay attention to circulation. Erections and prostate health both rely heavily on strong blood flow. Men often underestimate the connection between heart health and sexual health. Your blood vessels supply oxygen and nutrients everywhere, including the pelvic area. Regular masturbation can help maintain good circulation, but you can strengthen this benefit even more with lifestyle choices, like walking daily, eating foods rich in antioxidants, and staying hydrated. The more you care for your circulation, the more your prostate and erectile health benefit. It's also worth mentioning pelvic floor exercises. These are often recommended for women, but men benefit from them just as much. Strengthening the muscles that support the bladder, prostate, and penis can improve control, reduce urinary issues, and even enhance erections. When combined with regular ejaculation, pelvic floor exercises create a strong foundation for long-term sexual and urinary health. Now let's touch on the mental side of this. For men over 50, stress can take a serious toll on testosterone and sexual performance. Masturbation, when practiced in moderation, is a natural way to reduce stress by lowering cortisol levels and releasing dopamine and oxytocin, hormones that help you feel more relaxed and connected to yourself. But be mindful. If you use it as your only form of stress management, you may be missing out on other powerful tools like meditation, deep breathing, or simply spending time outdoors.
Think of it as one piece of the larger stress management puzzle. Another practical tip is to avoid rushing. Many men fall into the habit of trying to be quick, especially if they grew up feeling embarrassed or guilty about masturbation. But rushing can increase tension instead of relaxation, and it may train your body toward quicker release when you don't want that. Slowing down, taking time, and focusing on relaxation helps improve control and blood flow. Over time, this habit can even reduce issues with premature ejaculation. For men concerned about erectile dysfunction, masturbation can actually be part of the solution. By keeping the erectile tissue active and regularly bringing blood flow to the area, you're essentially exercising that part of the body. Just like any muscle, it responds positively to regular use. Combined with other healthy habits like lowering alcohol intake, avoiding smoking, and managing conditions like diabetes or high blood pressure, masturbation can play a supportive role in keeping erections strong. It's also important to stay hydrated. Prostate fluid is partly water, and dehydration can contribute to thicker secretions, which may make ejaculation less comfortable. Drinking enough water daily supports both prostate and overall health. And don't overlook the power of diet. Foods rich in zinc, like pumpkin seeds, and foods high in lycopene, like tomatoes, have been linked to prostate support. Combine good nutrition with regular ejaculation, and you give your body the best chance to stay healthy as you age. One more point that often gets overlooked: listen to your body. If you ever notice pain, blood and semen, difficulty urinating, or any other unusual symptom, don't ignore it. Masturbation is generally safe and even beneficial, but changes in your body are signals worth paying attention to. Always seek professional medical advice if something doesn't feel right. Many men delay checkups out of fear, but early detection is one of the most powerful tools in preventing serious problems. So what's the bottom line? For men over 50, masturbation is not something to feel ashamed of or avoid. When practiced in balance, it supports prostate health, maintains circulation, reduces stress, and helps preserve erectile function. It won't drain your testosterone, it won't weaken your prostate, and it won't rob you of energy. In fact, the science shows it can be a natural ally in staying healthy as you age. As we wrap up, here's a simple reminder. Your prostate health is about more than just one habit. It's about the full picture. Regular ejaculation, good circulation, exercise, proper nutrition, stress control, and checkups with your doctor. Combine these together, and you give yourself the best chance at staying strong, energetic, and confident well into later life. And if you found this video helpful, don't forget to hit that like button, subscribe to the channel, and share it with your friends. You never know who else might benefit from hearing this message.